The keynote speaker today is Professor Sudhangsu Sekhar Chakraborty, Chairman, Bengal Faith Healthcare Private Limited and Group Companies. He is also the Chairman Emeritus of Consulting Engineering Services Private Limited. With a wealth of experience of nearly 7 decades in the conception, designing and execution of crucial infrastructure projects at home and abroad. Prof. Chakraborty had several rare facets to his personality. I think this is very important for me to mention. A distinguished engineer, a scientist, an entrepreneur, an academician, a patriot, a global consultant, a visionary, and above all, a humanist.
We all have assembled here just to share some thoughts, and we don't want to perceive that thought in any manner in which you will not be able to tell exactly what we are going to ask for. This, as it has been told, faith means Bengal faith. That's not only just for the sake of telling. We have proved it, we have underscored it, and we have got that complete faith in Bengal faith. With this, what I am telling, that the Bengal faith is a health city. It is not, we are making this health city for the sake of any smart city. We are not creating more problems in terms of conveyance, in terms of transport, and we will, through our enthusiasm, through our dedication, and through the help of all our enthusiastic, philanthropic and caring investors from all across all across the globe, will be coming here in order to make that one a healthcare facilities which is worth. I am not going to mention the competition what we are having with the other healthcare facilities, because though I am grown up in this environment of Calcutta, I am also seeing this city for more than 6 decades at Delhi. And I have seen what is the status of that so-called big multi-speciality hospital which is surrounded all around of Delhi, and what a pathetic situation they are, and at what price. And that is what we are going to do. It is happening because that when we have got this medical hospital and medical college in mind, then we will be able to grow together and a more or less in a holistic healthcare facilities. And then this hospital will transit into a medical research center. Before I come to the medical research center, I should also tell you that we are trying to encompass a holistic approach to this healthcare facilities in the form of, healthness and wellness program, naturopathy, physiotherapy, and then mind setting. That all those things are not excluded. And then also we will have other ancillary facilities, like such as we should have the people who will be attending for this hospital patients or who needs the health care. There should be also facilities for their residing and their essential. And that is very difficult to get it in any metropolis. And that's why we are a little bit out of the metropolis. And that's why the Burdwan Health City is not merely a Burdwan Health Center is not merely within the metropolis or within a congested urban complex, but it is just on the outskirts. On one side and on the other side is free open land, and where we can still take the fresh air and breathing air, and they can stay at a reasonable cost and at a reasonable price for a long term. These are the facilities what we are going to get it, and at what price, at an affordable cost. And with that cost and with that facilities which could be comparable to anywhere in, I shouldn't say India, but anywhere in, at least in Eastern India, that facilities should be available. And once that is available, and once we can provide that facility, then we will develop the other components of the health city to make this city more vibrant and more carefree from all other hostile environment. Like we'll have a medical warehousing, where we will have a medical supply chain so that it is not interrupted, medical pharmacy, and many other things like, I don't want to go, you must have, there are quite a few of them, relatively younger people who must have place for the shopping mall and commercial complex and little business. But besides that, I would like to conclude by telling that I have got an overarching arch for research. And this research I am spent this morning also for some aspect of the research, and I am going to spend the whole day tomorrow. That's for engineering research. And this engineering research and this incoming medical research we are going to converge. And we are going to converge not through the some sort of an artificial intelligence or through distorting the neurological network, but to have a holistic approach of the mindset. Because what I'm seeing it every day, that when I read something, then when I make it a summary, when it goes through the process of artificial intelligence, I myself have seen this morning that there is a distortion when I'm going for some. We'll have to find in some way, we might have lost some of the face of Calcutta, but we don't want to lose the face of Bangalore. Thanking you very much. Thank you. I pray that it will come some more fruition. Thank you.